All right, it is 12 o'clock on the dot, so I thought we would get started. Um, Good afternoon or good morning for some folks on the call. Thank you for joining us today. My name's Kevin Testo. I'm a partner here at the Bonadio Group and the current human services industry leader. As many of you know, the Bonadio Group is one of the top 40 accounting firms here in the United States. My partners and I are really happy to be joining yet again our colleagues at Gallagher, one of the world's largest insurance brokers and consultants. In an effort to provide the best value to all of our clients, both Bonadio and Gallagher distinguish ourselves with the industry expertise that we bring to our clients, which is why we thought some of our getting together with some of our regional experts in the nonprofit space to discuss a handful of strategies for risk mitigation would be very beneficial to many organizations today. Looking at both the financial statement risks as well as the enterprise level risks are things that we're going to be talking about today. So we currently have over 250 participants registered today from all over the nation, representing various sectors of the nonprofit industry. Regardless of the particular sector that you work in or the particular funding streams that you have at your organization, there's no doubt we're feeling all the same type of increased risks and challenges, especially right now with a government shutdown. So planning and acting appropriately to reduce the impact on cash flow and operations is something that we're all going to need to consider even more over the next 12 months, if not longer. So we hope the presentations over the next 90 minutes will reinforce the tactics you may already be working through, while also giving you some different and fresh ideas to think about. Feel free to add questions into the chat. We're going to try to answer them at the end of each session where time permits. And if we don't get to your questions, we will definitely be following up with emails as well. So as a reminder for those who desire CPE, there are 6 polling questions throughout the session. Here's a slide also just to make sure that your audio and everything is working correctly. But as I mentioned, for those that need CPE, please complete the check-in form. You can scan the QR code. There is instructions as well in the chat. And again, reminder that there's 6 polling questions that will need to be submitted. And then we'll follow up with your CPE certificate in about a week to 2 weeks after this session. So that being said, I'm going to turn it over to my partner out of our Wilmington, Delaware office who specializes in nonprofits and human services. So I'll turn it over to Pete Kennedy to kick us off with our first agenda item.
Thank you, Kevin. My name is Pete Kennedy. I'm a partner here in the Wilmington, Delaware office. We work almost exclusively with nonprofit organizations, audits, taxes, consulting work. Looks like we've got the first polling question here. What has been or what do you expect the impact of the One Big Beautiful Bill Act to your organization to be? Obviously, there's not a right answer to this, but if you could all respond for CPE. And we'll give another minute for that. So the name itself implies with the One Big Beautiful Bill, passed along party lines. Instead of trying to pass individual provisions on their merits, it cobbles together a very wide range of provisions. Many have no relation to each other. This was percolating for a number of months, passed the House by a single vote, 215 to 214, went to the Senate. Many amendments later passed the Senate again by a single vote. Some of this is old news, I think, but and specific aspects aren't going to apply to everybody. 900 pages long. So first, so the good. There is some good in this. There are some positive provisions. charitable deduction for non-itemizers is back. It's been increased. It's going to go up to $2,000. Next, state and local tax amount, which was limited by the Tax Cuts and Jobs Act to $10,000, is going to go up to 40. One of the important aspects of this is that it takes effect in 2025. So there's a narrow window of a couple of months where your charitable deduction is going to be worth more because some of the bad things that we're going to talk about on the next slide won't take effect until 2026. Lastly, scholarship granting organizations. This is something I think is going to start getting some traction. This is not a new concept. Some states, including Pennsylvania, have had these for a number of years. Key points, $1,700 non-refundable credit for contributions to qualified organizations. Designed primarily to benefit private schools, K through 12s, but private or public school students are eligible to receive the scholarships. One of the big sticking points is that states have to opt in. There is no downside to the state, at least not financially, but there might be some political considerations for that. So before you invest a lot of time and energy setting one of these up, it might be a good idea to take the temperature of the state and see, if you think that's going to be viable. So far, Tennessee and North Carolina have announced that they're going to be opting in. One of the significant aspects to that is that North Carolina has a Democratic governor, so this appears to be getting some traction across party lines. New Mexico, Oregon, and Wisconsin have said that they will opt out. Once the state has opted in, they have to designate qualified organizations within the state and send that information off to the IRS. The consensus is it's probably going to be better to create a new 501c3 for the purposes of the credit rather than trying to work it into a pre-existing one. There are going to be some restrictions around those organizations. Eligibility, so scholarship recipients must come from households below 300% of the median household income for the area. So for comparison, Monroe County, New York, the median income household is $73,000. 300% of that is $219,000, so that's not a very restrictive provision. The allowable expenses are also pretty expensive. They include tuitions, fees, books, supplies, equipment, tutoring. I'm on the board of an organization that provides college counseling services to high-achieving high school students who do not have a history of college in their family. And my reading of the act says that the cost of that program would be allowed. Again, I think this is going to gain some traction. We're going to continue to monitor their state activity in terms of whether they're going to opt in or not. And please give us a call if you're interested in setting one of these up. So the bad. Again, many of these take effect in 2026. So there's a short window, 1% floor for corporate tax deductions. There is a pre-existing 10% ceiling. So we're already talking about a small amount so corporations will not be allowed to deduct more than 9% of their contributions. The 0.5% floor for individuals. So if you've got an individual with $200,000 AGI, that means the first $1,000 of their charitable contributions will not be deductible. Next is a variation on the old PEAS limitations that some of you might remember from before the Tax Cuts and Jobs Act. This reduces the value of itemized deductions across the board for higher income folks. So if someone has an AGI of $1 million, makes a $100,000 contribution, this will reduce the deductible amount by roughly $5,000. Colleges and university endowments, the Tax Cuts and Jobs Act, you may recall, imposed organizations or universities with more than 500 students, more than $500,000 in endowment per student, 1.4% excise tax on the net investment income. This ups that considerably. And I think it's aimed primarily at the Ivy League schools. The brackets are increased substantially, if up to 8%. So Princeton with a $3.7 million endowment per student, that's going to be very expensive. You may recall also the Tax Cuts and Jobs Act imposed a excise tax on employees of nonprofits making over $1 million. This expands the pool. It used to apply only to the top 5 earners of an organization. This expands that to everybody in the organization and also includes former employees. So if you've got it's possible to get into trouble with this if you've got deferred income. This includes deferred income. So if you've got a high earner, relatively high earner with a deferred income that you're getting ready to pay out on retirement, you're going to want to take a very close look at this. Last, employee retention credit. I promised Kevin I wasn't going to jump into my ERTC rant. If anyone's interested and you've got 45 minutes and nothing better to do, give me a call. I can go on and on about this. Briefly, poorly designed, poorly implemented, requirements for eligibility shifted, numerous occasions, poorly understood by the organization, and result poorly monitored. Another sad chapter with the One Big Beautiful Bill, 3 years too late. We're trying to slam the barn door, I say. Audit windows expanded to 6 years after the claim is filed. It's only for third quarter of 2021. They appear to be focusing on third quarter 2021, targeting it. These provisions only apply to third and fourth quarter, and the fourth quarter, you might recall, was limited only to COVID startups. They also appear to be targeting ERC mills. These are the ones that were sending out the ads, 26,000 per employee. They're going to be difficult to identify because they generally try to hide their involvement with many of these applications. They retroactively truncated the ability to apply for the credit. So if you applied for the credit at some point between February of 2024 and April of 2025 for third quarter, primarily 2021, that's going to be automatically rejected. I suspect we're going to see some legal action around this, but we'll see. Bottom line is, if you've got some questions on this, if you had a mill, one of the ERC mills, prepare your application. Want to see if there's any exposure, or, God forbid, if you've gotten an audit notice, please give us a call. The debt ceiling increased by $5 trillion for comparison. That's a stack of $100 bills from Rochester to San Francisco and back. A lot of money. And then lastly, but worse, for medical organizations, the restrictions on Medicaid and the ACA, new eligibility requirements does not address the expiring ACA premium credits. I know I was on the finance committee of a local hospital when the Medicaid expansion went into effect, and it was a godsend. Basically, 5% of their fees were getting written off. They were called self-pay. They would write those off. Now while these were in effect, they were able to collect on that. At a time when hospitals are closing, that's going to be very difficult to absorb. So wanted to talk about a few other provisions that wound up on the cutting room floor here. I think everybody understands how these bills are evaluated. They score each of these by the CBO, and the sum of the scores has to be 0. So if you've got a giveaway, you have to figure out how to pay for it. I think of the scoring in the same way that Mark Twain talked about statistics. There's accounting, there's creative accounting, and then there's scoring. So firstly, of these provisions have been scored. They were included in the original House version of the bill. So 215 members of the House voted for these provisions. Somewhere someone has these provisions on a list as a way to potentially pay for things. So sadly, I think we're going to see these again in some form or fashion. Private foundation excise taxes, you might be thinking, well, private foundations have lots of money. Why not, make them pay a tax, or a higher tax? The issue is that the distributable amount is directly affected by the tax. So for every dollar that goes out the door in tax, that is one less dollar that's going to be distributed. So a simplistic example, we've got a $500 million foundation, 10% taxable return under the revised bracket system. They'd reduce their granting by roughly 1.8 million or 7.2%. So not good news. Next, I'm sure many of you recall the parking tax fiasco. This was a provision that required nonprofits to pay unrelated business income tax on the cost of providing employees parking that was passed into law with the Tax Cuts and Jobs Act 8 years ago. The IRS had actually issued implementation guidance. We were on Google Maps counting parking spaces and telling our clients how to kind of plan for this. We were, reconfigure the employee parking. Somewhere along the line, cooler heads prevailed here, and this absurdity was taken out. So I was pretty gobsmacked to see this return, to be honest. This was kind of a real shock to the system, given how unpopular it had been 8 years ago. Again, it's got a number on it, and somebody somewhere is going to use that probably at some point to try to balance something else out. Same with the royalties and logo for unrelated business income. That's primarily aimed, I think, at the large colleges with the large sports programs. Currently under IRS Circular 230, there's a prohibition against contingent fees for tax prep services. For some reason, someone had decided that it was a good idea to remove that. Again, 215 people in the House of Representatives voted for this. I don't think we have to look too far in the rearview mirror to see, the previous slide to see where that kind of where skirting around that was problematic. So when we were putting these slides together, I kind of hoped that we would be able to remove this one. The automated payments will continue, obviously. In most cases, while the funds remain allocated for payments of federal grants, the people who would process the applications are not there. So if anyone has I know we've got a couple of clients in this situation, they're going to be waiting for their money. The IRS, nearly all the workers are furloughed. At the IRS, if the COVID experience was any guide, the last person out the door does not turn off the computer that issues the tax notices. So those are going to continue, but there's not going to be anybody there to answer the phone when if I call with questions and try to figure out what's going on. Lots of fear and apprehension. I'm the treasurer of an organization that they don't get federal funds directly, but they rely on funding from other organizations that do get federal funding. Basically, we've had to lay off most of the employees. We're going into hibernation, hoping that that spring is going to return at some point. So not a good situation for many organizations. The foundations here actually have set up special grant programs where they are paying grants to nonprofits to figure out how to either merge with other nonprofits or shut down entirely. And that's kind of a sad process, obviously. $100 million obviously is a rounding error in most state budgets, but it's a lot of money for Delaware. The funding for nonprofits is a discretionary item, so that it's on the chopping block, unfortunately. And that was all for me. I think I'm going to pass it on to Jen.
Thanks, Pete. I believe we have a polling question coming up. So is your organization currently tracking and reviewing KPIs routinely? Yes, monthly along with our financial statements. Sometimes when we get around to calculating them, no, we don't have the resources or time to do so. And this will lead nicely into the next section that I'm going to cover. And I probably should introduce myself first. I'm Jen Arbori, a partner in the Rochester office of the Bonadio Group. I spent 21 years as an auditor of all various types of nonprofits, shifted about 6 years ago into the outsourced accounting space and work now really on outsourced accounting solutions for nonprofit organizations. And what I'm going to go through today is going to be all of the key performance indicators. So talking more about data-driven financial management. So in this segment, we're going to focus on how nonprofit organizations can use data-driven financial management to really proactively identify and mitigate risks. Too often, organizations spot financial or operational challenges after the fact instead of being able to be proactive. They've already had an impact, something's already occurred, and we really weren't aware of how or why that happened. So by tracking the right metrics and really understanding what the data is telling you, you'll be able to see some early warning signs and make informed decisions. We're going to walk through some meaningful KPIs, how to interpret them, how to use that information to guide strategic conversations, whether it's with leadership, grantors, funders, state agencies, and your board as well. So who's monitoring nonprofit performance? I just think it's important for individuals, in and outside of nonprofit organizations, or those of you that may potentially be board members, to understand that you're not the only one that's looking at your numbers. Most of you are probably aware you've got donors and grantors, you've got charity evaluators that are looking at what's going on, community, other nonprofits, and we really have to show fiscal responsibility along with programmatic results. They're both equally important. I often get asked, well, is the fiscal responsibility side more important? But this organization is very focused on tracking outcomes. They're both important and have to be weaved in together. So efforts to track metrics really will encourage that accountability. Other organizations will see what's going on. So just be mindful that you're calculating these. We're going to talk more for use internally, but this is something that from an external perspective can also be important as well. So I want to talk a little bit now about the nonprofit landscape and how it's continuing to change. And, Pete really kind of set the stage as far as what's going on from a government uncertainty standpoint. We're still in a shutdown. There's a lot more that's going on there. Organizations are operating in what, like I said, I've been in this almost 30 years now. It's one of the most challenging financial environments that I've ever seen. Funding cycles are tightening, reimbursements are being delayed. It's creating cash flow gaps, day-to-day strain on operation. And at the same time, inflation's driving up wages, service delivery costs, and it's stretching your organization's budgets further and further. And along with that, you're stretched as far as you can be, and you've got funders and auditors and your board members who are trying to raise the bar. They're expecting more timely and more data-backed, reporting. You can't walk into a meeting and say, yeah, everything looks good, or we're trending along as we have been. There's a lot of skepticism there. So being prepared with that data and information is important. Organizations that are thriving are the ones that are using the data strategically to anticipate pressures, to monitor the trends that are out there, and really make informed decisions before they truly do escalate. So what is the challenge for human service organizations? And this does go beyond human service organizations as well. But just to kind of sum all of these up, one of the biggest challenges is juggling multiple grants. And in other organizations, it's multiple funding sources, because they all have their own sets of rules. They all have various allowable costs, reporting timelines. You take that and then add on the compliance and reporting burdens. Those demands alone are intense. It takes a lot of coordination to stay on top of all of the things that everyone's looking for. And most organizations that we work with see that a lot of this is being done through static spreadsheets or manual tracking of systems. And some of those can work fine in the short term, but it's hard because they're not providing that real-time visibility to consolidate or access data across multiple programs. And so leadership ends up really looking in the rearview mirror. So they're constantly looking back at reviewing what happened last quarter, reviewing what happened last month, rather than having a clear view of upcoming risks or current performance. And without that timely insight, it's hard to spot emerging issues. It's hard to see that overspending is likely. It's normally the case of, we overspent. Billings may be delayed, compliance gaps, and a lot of these things are happening kind of, they're not being noticed until after they're occurring. So the challenge we talked about, so let's talk about the opportunity. So the opportunity that we have is to really look at data as a strategic asset. not just for reporting, but for real decision-making tools. There's three things we're going to talk about today. We'll spend the most time on KPIs, and there's also a couple of others, but the KPIs really turn data into meaningful insights. When they're tracked consistently, and that's really the key. The key is going to be consistently. This isn't a just calculate your KPIs and set them on a shelf. The key to the data and the information is that you're looking at it and there's comparability from period to period, month to month, quarter to quarter, whatever you decide, and that you do that on a routine basis. The second concept is predictive analytics, and that's that forward looking. We're going to focus on cash flow and cash flow forecasting. It really moves us from kind of looking backwards at the cash that's been spent to what's ahead for us. What do we see in our cash flow, our timing of revenue cycles, and our expenses, and kind of forecasting liquidity. And then the last one we'll talk about briefly are interactive dashboards. And these are really modern tools. I don't see a lot of organizations that are currently deploying things like interactive dashboards, but we'll talk about what those look like and what types of tools you might want to look at, for your organizations, as you move forward. Because ultimately, using these modern tools are a way to strengthen both mission, sustainability, and to mitigate risk. So on the key performance indicator side, what is a KPI? It's measuring measurements, or metrics that help assess performance and progress. They're simply, are we making progress towards a goal? They're financial and operational. And I often tell organizations to think of these as dashboard lights. They tell you when things are on track or when something might need attention. They give us a snapshot of financial position, but they also help us to understand the trends over time. That's why I made that comment about decide what you're going to calculate and do that consistently, because you need to be able to see the trends. KPIs are great, but if you're not looking at them at very specific points of time, it's hard to tell. Are we improving? Are we flat? Is something declining? And then why? And the other thing I want to make clear today is every single organization will choose the KPIs that are important to them. There's a few we'll cover today that I think are a little more universal, but there are a lot of KPIs. And there's no one size fits all list that's perfect. I've been asked before, are there, what should we all be doing? Again, it depends on the type of organization and which operational and financial KPIs are important to your type of nonprofit, to your specific organization. There's a lot of things to be determined there. So it's not a one size fits all type of a list, but it's important to determine some KPIs. And then, why? Why do you want to, why KPIs? They measure results, obviously. They quantify the performance. You can track it against a goal. They can be used as a foundation for action. So what does that mean? It means it helps to guide decision making. Do we reduce costs, realign resources, invest in a particular opportunity that we might have? Risk management. We're here talking about risk management. They help highlight potential risks earlier than, so you're able to be proactively mitigating them instead of reactively dealing with them. You can make them strategic in nature. But one of my favorite things and most important things I think about KPIs is it encourages questions. It promotes inquiry, because as you're looking at them, you ask why. Why did this go up? Why did this go down? And that's where conversations begin to ensue about what do we need to do. So then you go back to what's the foundation for action now that we've said, well, this is going up because of this, or this is going down because of that. So very mindful of kind of the questions and the inquiry that happens with the KPIs. So now we're going to go through a few of the more common, KPIs that are likely applicable, that are applicable across most types of nonprofit organizations. And I'm going to guess that if I, took you all off mute and said, what's your program expense ratio, that the majority of you would probably be able to tell me your program expense ratio, because obviously this is the one that gets focused on quite often. It's the measurement of the percentage of expenses you're spending on your core mission. It's looked at by funders and grantors and, in so many different charity navigators and so many different capacities. And everyone has their benchmark. I will say, this is when I get asked all the time, what is the benchmark for a program expense ratio? when I started in the accounting world years ago, this was something where it was like your program expense ratio has to be as high as possible and admin has to be as low as possible. I am glad to say that a lot of the charity evaluators and funders have realized also the importance of overhead and investing in your organization. So where this was something where we already, you were encouraging 85, 90%, that those days it's different today in that, 70, 75, 80, again, depending on the size of your organization. Smaller organizations are inherently going to have a smaller program expense ratio because there's always going to be a baseline for overhead. So again, this is one that it really comes down to what is your program expense ratio and what is the consistency of that? Or are you looking to increase that? And if you are, is it growth in a program? Are there cuts that need to be made from an administrative perspective? But really a great one to be tracking and monitoring routinely. And so then conversely, on the flip side is that administrative expense ratio. Obviously, that's measuring the percentage that we're allocating to administrative costs. I made the comment about this one was often misunderstood with this whole overhead myth. I do still see funders out there though that will say, we're not going to fund it we're not going to fund you unless you're 85 or 90% program. And it's just, in my opinion, it's just hard to sustain that when keeping up with technology costs is challenging. Keeping up with, just infrastructure, organizations have to spend money on overhead. So I think fortunately, again, this has started to subside a little bit. And so there's a little bit more of space in the administrative expense side than there ever had been before. But again, it comes down to tracking and monitoring. If you were at 20% and all of a sudden it was 25% and 30%, it's like, okay, well, why is this going up and do we need to do something to mitigate it? The other one that is important to really be aware of is personnel expense ratio. And this is one from the perspective of kind of running your organization. Obviously personnel tends to be and almost always is the largest expense in a nonprofit organization. It's there's a simple way to kind of to track and monitor that. You're adding all of your salaries, wages, and benefits, and you're looking at that versus your total expenses. And it's one of those things though where I often get asked, okay, well, what's the right number from a personnel expense ratio? And this is another one that's a little challenging to give you a specific, benchmark to go by, because it's going to look very different from one healthy nonprofit to another. I mean, you could be a very heavy volunteer organization and your personnel expense ratio may be a little lower because of that. Doesn't necessarily mean anything. What the importance of this ratio is calculating it and figuring out, okay, we're at 40%. If all of a sudden we go from 40 to 38 to 36 to 32, and we're feeling pinched, and we look at this ratio, it's like, wait a minute, do we need to add someone along the way? Should we add staff? And then in the converse does it start to rise? And it's like, well, we have too much staff. Or I don't think that's even a thing in a nonprofit. I shouldn't even say that out loud. I don't think any nonprofit I know has too much staff. But again, maybe there is a situation where you had too many staff in a particular program. Are we staffed appropriately altogether from admin to personnel? So it's again more important for you to identify what's normal in your industry niche, and that when you're calculating this, you're kind of tracking the trending again of that ratio. That will help you to answer questions when someone's like, well, we need to add a staff. Okay, well, let's look at this ratio. Let's kind of see where we've historically been from a staffing perspective. Do we feel like we're well staffed? We do at this percent versus that percent. So again, using it really to compare against yourself in many instances when it comes to the personnel expense ratio. The next one we're going to talk about a little bit is the revenue side, revenue. I'm going to focus a little bit more on the revenue reliance side. And that's really, is there a concentration in a particular funding source or type of funds? Are you heavily funded, state funded? Are you heavily federally funded? All the things that are important to be looking at right now in the current, environment that we're in. And many organizations are finding that they are. I mean, you already know you're 70, 80, 85% funded, whether they're New York State funding or government grant or federal grant funding, or private funding, whatever that mix of funding looks like. But one of the things we're suggesting too is to go one step further into evaluating revenue reliance by maybe the funding agency. So if you are 90% funded by, New York State, you look and say, okay, we are in New York State, we're only funded by 2 agencies. Well, that could be, tough if one of them gets a major cut, or depending on what happens at the federal level and things go. Or are we're in like 7 or 8 different agencies. Now that makes more work. There's pros and cons, obviously, to all of this, but it's really having an understanding of where does the risk lie? Where do we have all of our eggs? Are they in one basket? Are they in 12 baskets? And then which of those baskets presents the greatest risk potentially? Again, all these are meant to do is for you to be thinking about where does potential risk lie, and awareness of, where your major funding sources are. And then the last one that I want to talk to you from a KPI perspective is operating reserves ratio. This is really how long can your nonprofit operate on the reserves that you currently have. The calculation is a little bit more complex because there's a few, kind of pieces in there. And oftentimes you'll hear someone say, well, you want to have a minimum of 3 months of expenses, in your operating reserve ratio. So you calculate this, it comes out to 25%, or, 3 months worth of a 12-month year. And then it says, well, is that really the right number for our organization? And in a lot of cases, it's not necessarily the right answer, because if your nonprofit's receiving grant funding on a reimbursement schedule, and that's taking 6 to 9 months, you may need 6 months or 9 months. Now, that might not be realistic, but if you look at what you need, then you have to plan to kind of try and increase that operating reserve ratio. So again, you calculated at 3 months, or you've got a solid 3 or 4 months, you really are looking at it like, well, we should have 6 because of the different factors for our particular organization. Same thing, if you have funding sources that are exposed to greater risk of interruption, you might want to take a look at it and modify what you think your benchmark might want to be for that operating reserve ratio, but really kind of an important one from that perspective. And then I get asked often too, how do you increase that operating reserve? And that does take some thoughtful planning. If you make the decision that you need to additional 3 months worth of reserves, the board may need to look at the budget for the next year and say, okay, we need to plan to save X number of dollars if possible, or try to promote a surplus budget. Not that these are realistic items, but it's the thought that may go into, well, what do we do? Or the planning could be, we have to secure additional dollars on our line of credit. They're just decision-making tools. You may never be able to increase your operating reserve, but what do we do in the event that we don't have the appropriate amount of reserves to pay, to make payroll, to pay our vendors and so on? So all planning tools here. And then there's a couple more slides, and I won't get into them in a lot of detail, with additional KPIs that are for consideration: days cash on hand, looking at your receivables, current ratios, debt to equity, as well as operating margins, age of fixed assets. And I'm going to pause on age of fixed assets for a second, just because I've had a lot of organizations say, well, age of fixed assets, why am I tracking that? But that can be, I've had clients where a huge hit comes because they need a new roof. And they kind of know them, but they just wanted to ignore it. And then it happened and it became a bigger issue. So just kind of thinking about when those major expenses might hit. Another thing from a KPI perspective to potentially track and monitor. And then the main thing, and I've said this a couple of times already, so I won't kind of beat it up too much more, but the whole point is to look at the trending of the KPI that you're tracking and what is it telling you. So I'll just use a quick example here of days operating cash. And this is year over year over year. I would encourage these are calculated either monthly or quarterly. But days operating cash on hand in 2022, we had 1,000 days. In 2023, we had 308. In 2024 was 139. The question here is like, whoa, why is that going down? Well, conversely, look at how the days in the accounts receivable has gone up. So our AR is going up, our cash is going down, which I'm experiencing in almost every client we currently work with right now, given the delays in government shutdowns and fundings and reimbursement cycles. So just the ability to answer those questions, right? The why is this going up? Why is this going down? So looking at that data and information. And then one other comment on benchmarks. I often get asked about how do we benchmark? A lot of the best sources of benchmarking information I've seen is professional associations. So for those of you that may be in a more specific, niche, nonprofit niche, whether it's a community action agency, whether it is, you're a college or a university, whatever you may be, looking at what the benchmarks are for your particular type of nonprofit is helpful, instead of trying to just, look at something a little bit more generically. Peer comparisons, if you have organizations that are similar size and have access to their 990 and can kind of calculate some of those things yourselves. And then obviously your own historical data and information just to see trends is hugely helpful. And then I just want to spend my last couple of minutes talking about predictive analytics or cash flow forecasting and the importance of this, especially in the type of environment that we're in now with the level of uncertainty. It's really an early warning system when you can kind of take a look forward and see if there are going to be major issues with cash flow coming down in the next several of months, and then being able to model or look at different scenarios or what if situations, what if reimbursements are delayed even further. So kind of taking that schedule and pushing things out. What if there's additional budget cuts or increasing costs, and kind of taking a look at those types of items. So predictive analytics and cash flow forecasting is extremely important, especially in the situation, like I said, that we're in currently. And this is a very representative of kind of the cycle we're seeing, especially in grant funded and reimbursed contract funded and grant funded organizations, where we're starting with very little cash. We go through a quarter, we voucher, we're getting that cash in, cash spikes up, we're spending all of our money again, cash goes back up. Fortunately, in this illustrative example, that red dotted line along the bottom is kind of like our baseline. But what I'm seeing now happen is organizations are going below, basically dipping below either zero or what they're comfortable with from a cash reserve, and they're needing to go on their lines of credit. So one of the mitigating risks is, do we have a line of credit? Do we have a good relationship with our bank? How quickly can we get on or off with these funds? And do we need to expand? A lot of clients I've worked with from a risk perspective have actually sought an expansion on their line of credit with their banks, knowing that things are going to get a little tougher as we move into the next, several months potentially. And it looks like we have a polling question here, polling question 3. Which of the following best describes how your organization uses interactive dashboards for risk mitigation and decision making? We use role-based dashboards. We have dashboards, but they're not specifically tailored to roles. We do not currently use interactive dashboards, or I am not sure. And speaking of interactive dashboards, my last couple of slides I will take you through are about interactive dashboards. And dashboards really transform data into action. They empower teams to manage proactively versus reactively. They are real time. And there's a bunch of different types. So there's the role-based dashboards, which are going to be more specific to a specific role in an organization. Outcome metrics, digital board dashboards, and compliance dashboards. So instead of relying on a spreadsheet or a report that might be outdated by the time it's shared, These dashboards really offer kind of real-time updates, allowing staff and leadership to make faster and better informed decisions. You can also build alerts into dashboards. A red indicator might mean a grant is near overspend, just things that are visually easier to see, even for people who may be non-financial in nature. And it really helps to support that internal management, but also transparency with funders and boards when you can pull up an interactive dashboard in a meeting and share kind of status of where you are. Couple quick examples. There's one here, role-based. This one happens to be more on the programmatic side. You can see some of the information here. Actually, this one may be more CFO based, but either way, one can see, like CFO might see cash flow, program director might see grant spend. Again, they can be customized for the user of the information, but it's visual. It gives you visual depictions. Those things at the top are called little key cards, which are key pieces of information that might be important to a specific role. And then the same thing with outcome metrics. So this one's really going to be a little bit more on the side of how does funding translate into impact, number of clients served, services delivered, community outcomes, cost per client, things of that nature. But again, very visual, so you can kind of see that overall data impact. And so on my final words and takeaway relative to the whole key metrics is, for most organizations, the idea of really leveraging dashboards, analytics, predictive tools feels out of reach. I mean, you're probably sitting there thinking, like, we don't have fancy dashboards and we don't have a lot of these things. And some of them come with the more modern cloud-based financial solutions. They're things that we use to deliver services for some of our clients. If you ever have questions on softwares or options or how you can get things like this, happy to answer those. But what I want you to do, if you take away anything today, is to just start where you can, right? Even if you pick a couple of KPIs that you start to track, that you're looking at and you're really kind of zooming in on for the time being and are the most important for tracking and monitoring where you are in your organization, that's a big step. It might feel small, but it is a big step. That information can help make small strategic decisions little by little that are just going to help your organization in the longer run. Data-driven strategy is not about having the perfect system that, looks all pretty and shiny. It's about really creating the clarity that you need, the accountability that you need, and the alignment both in finance and program that gives you the insights to move your organization from being reactive to being very proactive. A lot of information. I just kind of ran through all of that. I don't know if there's any specific questions here. If not, I'm going to pass this over to Gallagher. Or maybe I'm going to launch polling question number 4 first. So true or false, predictive analytics and interactive dashboards can help nonprofits forecast cash flow, identify funding gaps, and support strategic decision-making. That's polling question number 4, true or false. And now I'm going to go ahead and pass it over.
Thanks, everyone. So my name is Chad Marvin. I work in the employee benefits area as a consultant here at Gallagher. And on the benefits side, we currently work with 1,800 benefits and HR consulting clients that are specific to nonprofits. There's 6,100 nonprofit clients globally that we work with, and there are 200 plus U.S. social services organizations that participate in our annual benefit strategy and benchmarking survey. So we definitely have a lot of experience working in the nonprofit space. Another stat I wanted to share is when we look at educating our clients and getting ahead of potential risks down the line. So routine medical appointments and preventive screenings are declining in the United States and including in New York State. So according to the Prevent Cancer Foundation 2025 Early Detection Survey, only 51% of US adults aged 21 and older reported having a routine medical appointment or cancer screening in the last year. So that's a 10% drop. And we're constantly, not only at open enrollment time when we're preparing benefit guides and speaking and trying to help people make plan decisions, we're trying to be more proactive in educating on the age brackets to receive certain screenings. Because when people get out in front of those things and they use what is covered in full in their health plan, even on high deductible plans, that's where it can help prevent those high cost claimants that come up at renewal time that drive those increases. So our people insights analysis, this is a mini workforce analysis that we offer. It's part of our Gallagher Drive analysis program, where you can get an idea of the look and feel of what working with Gallagher on the benefit side might look like. And what we do is we take in some simple categories of data from a census standpoint, and we plug it into our tool, and it produces an output that looks like this. This is the first slide of the output, and it's compared to our benchmarking data that I referenced when I first started speaking about our national benchmarking survey. So many organizations that are on this call today likely fall in this benchmarking category of individual and family services. So what we do, the data that we input shows up as sample client, or in the blue on this chart, and the benchmark data for individual and family service shows up in orange, right? So on this slide, you can see the median age is 42 for the sample client on the bottom right-hand side of the slide, and the benchmark's at 44.7. You could see prevalence of 65 and older folks versus benchmark. We capture date of hire, so we can dig into your overall tenure and how could your benefits package be playing into your attraction and retention efforts, right, versus benchmark. And we also look at male-female prevalence. So that's that bottom right chart. In the top left charts, they're breaking up the makeup of the organization into 5 different categories or populations. So exploration is under 25, you have establishment, mid-career, late career, and pre-retirement. And you can see in the chart on the bottom left, it shows how many folks for this sample organization slot into each category. And it gives their the distribution percentage by company in these categories, and then tenure by category. Now, the next slide is going to break it down and give us more overall characteristics. So when we're talking about areas to focus on throughout the year and at open enrollment, from an education standpoint, to help members become more engaged and tapping into carrier tools and value adds that are part of their health plan, and signing up for mobile applications and trying to encourage healthy behaviors. When we frame it around feedback from human resources and your actual population, we can dig into these specific engagement needs at the bottom of the slide and specific health concerns. So these are general to give us some direction, right? Then when I go to the next slide, this gets into more detail on specific disease prevalence based on where people live in the census that they provided us with. So to keep this simple, at the bottom of the slide, you could see what the high prevalence threshold percentages are by category. So there's arthritis, asthma, cancer, coronary heart disease, COPD, diabetes. You can see the examples. So you'll look at the pockets of the population where you're seeing quite a bit of red. So in general, you can see cancer is approaching the threshold of 8.3. But as an example, Dunkirk, which has 15 people in it, it's also highlighted in red because it was flagged as there are some folks that are impacted from a social determinants of health standpoint, which I'll talk about on the next slide. But you can see they're in red for coronary heart disease and COPD. So we want to get out in front of that by educating on cardiac care and healthy preventive screening activities that can help people from becoming a high-cost claimant, as I spoke about before. And how can they get engaged with chronic condition management programs that are offered through the carrier or through third-party vendors as well. So it gives us a lot of direction that's specific to the client. So this last slide that I have is the social determinants of health impact that I referenced when I was talking about Dunkirk, which is first on the chart with 15 people. So we look at things like median household income, unemployed percentage, if they're possibly receiving food stamps or without health insurance. And we're going to use this to determine, are they also having trouble accessing health insurance? Like, one of the first questions I always ask is your current network the right fit for you? Because there are different network options like HMO, local networks, versus EPO and PPO, national networks. And each carrier is going to have different breadth of providers that are covered. So this goes into understanding your population. And also, if there's folks that need additional assistance, that's where these social determinants of health come in. And with that, I thank you very much. I definitely want to give time for questions, and I will be transitioning it over to James.
Thank you so much, Chad. Yeah, I was there's so much data that comes through, I think, everyone's desk, both at Gallagher and Bonadeo, and I was really excited for Chad to share this section with us. I know with a lot of the human service organizations I work with, many of which work specifically in poorer neighborhoods, you know, a lot of these social determinants of health are really going to pop. And it's not just, I mean, sort of the data suggests that when you live in a less well-off economic neighborhood, the health outcomes are worse. And some of that just has to do with access to care. So thinking about what we can do to get our line level employees the screening and the preventative care they need, I think is a key part of moving our organization forward. So when I practice these slides, Chad told me correctly, this is kind of a confusing one. So I'm going to try to walk through it sort of slowly. The one to start here on the right-hand side, this is a visual of the risk management framework. You know, when we're into one of our clients talking about insurable risk, we talk about risk management all the time. Chad, we have a little question in the chat. I'll let you can just interrupt me whenever you're ready to answer that.
Appreciate it. I'll take a look at that right now.
Yeah, great. Yeah, thanks so much, Bill. We love the interaction. I think it makes for a better presentation. But this idea that we identify these different risks, we assess them, we review what are we going to do about this risk, and then we control, we actually implement something, and then we identify it again. And, you know, this is something that I think all of us do intuitively in our own lives. You're looking around your house. What projects do I need to be done this year to take care of my home? You're looking at your family, you know, when should we be looking at buying a new car so we don't break down? You know, what sort of things do our kids need? And a lot of it is just you see it and you adjust. And for smaller organizations, that mentality works just fine. I have a coworker who his dad, he grew up working with his dad. His dad was a director of summer camps in the 70s and 80s. And we know now there were a lot of issues back then with really sexual predators that were not really screened out. And, fortunately, his dad never had an issue. And I think part of that is that every evening this director would go and he would stand in the dining hall next to the kitchen, and he was just there for everyone to walk by. And he could sort of identify and assess who's having an issue, who's not getting along, who's not getting the resources that he needs, and you can take care of that. When your organization gets a little bigger, you can't have one person who does that, but odds are on your leadership team, if you have 4 or 5 people in your C-suite, your CFO, your chief program officer, maybe you have a compliance officer, those people are doing that in their departments. They're looking around, they're talking to people. And then when you have a leadership meeting, everyone in that room can sort of say, yeah, we should think about this, or we should talk about that. It's very holistic. Once your organization gets above about 150, 100 or 200, I think in psychology it's called Dunbar's number. The number beyond which you can't really know everything and everybody in a personal way. People become more of a number. That's when this sort of looking around and identifying and assessing risk doesn't work as much anymore. And I will tell you, my work, I'm in and out of maybe 100 different nonprofits every year. The areas where I see the biggest, falling down when it comes to risk management are these larger organizations, because this risk assessment paradigm hasn't become more bureaucratic, more systematized. Some of you are running organizations with hundreds, if not thousands of employees, and you have layers of bureaucracy. You have systems for HR, for employee reviews, but you don't necessarily have that for risk management. So what I'm going to be talking about here in the next couple of slides is a tool that Gallagher provides really to any organization across any industry at no cost to help you assess your risk. Now, this is not just insurable risk, and now we're finally moving over to the left side of my slide, because traditional insurance is really just covers your low likelihood, high impact. There's a very bad car accident, people are injured. Someone falls downstairs and subsequently needs to be hospitalized. Low likelihood, high impact, you get insurance for that. But there's this whole rest of the 3/4 of the quadrant where you don't buy insurance. So you think about on your lower left-hand side, this low impact, that could be something like we have a Jennifer referenced, replacing a roof. Maybe our 25-year roof only lasts for 20 years. This isn't an issue that happens all the time, but yeah, that is a risk. We have to adjust financially. Up at this low impact, high likelihood, an employee not coming in for a shift, someone quitting just before a big Thanksgiving dinner, a client who lashes out physically or verbally. These are high likelihood scenarios in human service. Again, risks, you probably have a system that's picking these up and adjusting. But for our high likelihood, a high impact, we could have an abrupt exit with a senior leader who has significant connections, who has a lot of institutional knowledge. We can have these changing donor and funder priorities, like Pete referred to in the One Big Beautiful Bill changes. So there's a lot of these risks. And even if you're working really closely with Gallagher or whoever your insurance broker is, your system isn't necessarily going across this entire quadrant. So I'm going to go to the next slide.
James, I'm just going to jump in
Chad,
quick.
are you ready to jump into this question?
Yeah, I'm just going to jump in, and Bill, that's a great question, and I'm so glad you brought it up, because part of what we spend a lot of time focusing and educating, promoting, when I mention carrier tools that are available with the health plan, you bring up a great point about everyone is very busy and working tremendous amount of hours, and childcare is a challenge, or you have sick children at 4 or 5 o'clock in the morning and trying to find the most effective way to get them care. So I want to call out that we spend a lot of time looking at care that might be falling in an urgent care or emergency room setting that's low intensity enough to be converted to a virtual setting. So I think you raise a great point. There are many carrier tools on virtual health now where you can meet with board certified doctors that can even prescribe medication from the convenience of work or at home, right? Um, and that's going to save everybody time, energy. And many of these plans are offering $0 virtual care these days when available, or a low cost share. So I think that's an excellent way to not only help an employer group in mitigating some poor claims experience, but also to just seek convenient health care and help with access to care. Does that help, Bill?
Yeah, I think what I like about both of your comments is we're looking beyond, hey, why do our employees who live in lower income zip codes statistically have worse health outcomes, and trying to think creatively about what we can do to help. Um, that's the kind of proactive thinking we're trying to facilitate. So, yes. So, and I didn't call this out, so hopefully you read my slides. What percentage of organizational risk is uninsurable? A, B, C, or D? With A being 40 to 50%, B being 50 to 60% uninsurable, C 60 to 70% being uninsurable, and D 70 to 80% being uninsurable. I'll leave it there for another minute before I go on to the next slide. Yeah, and this is, I think if I had more time with every one of my clients, I would talk more about these uninsurable risks. Unfortunately, there's so much to talk about with the insurable risks. Sometimes that takes up our entire meeting. But a lot of times these uninsurable risks are these things that can really significantly derail an organization. I can't tell you how many organizations that have had an unsuccessful leadership transition that, it doesn't show up as an insurance claim, but when you look at the outcomes for employees and for clients, it's less than ideal. So
And
this
as a
risk,
reminder for everyone, there is a conferences IO button on your top panel to access these polling questions. And there was a QR code also, just if you're looking on how to access those.
yeah, thank you so much, Chad. So this, I mentioned this tool. This is a survey tool. You can customize the survey for your organization. Some organizations, they just send this out to their C-suite to sort of take everyone's temperature. How do we think we're doing on all these different areas of risk? Other organizations will send it out to every employee to say, we know what we do for, HR training and redundancy, but what's your perception of what we're doing to manage risk? As I mentioned, this survey it comes out of one of our consulting teams. It is always available at no cost. So if you work with a Gallagher consultant and you want to request this risk map, let that person know. We could get this deployed to you. You can also reach out to the team directly. I dropped the email address in the chat. So we usually have about 60 questions that we include. And some of these are, we're looking at capital. We're looking at cash management. A lot of the things that Jennifer looked at earlier. We're not just looking at insurable, we're looking at all these different uninsurable areas. So you ask your participants to very easily, how likely is this to happen on a scale of 1 to 5? And if it does happen, how bad would it be? Scale of 1 to 5. You're not asking people to justify. It's just kind of a point in time. How do you think we're doing managing the risk? And then on the back end, the software allows you to look at some of these different risks. And you can see here, hey, on a bunch of risks in this HR section, we thought 1 was doing good and 11, we were doing okay. So you can see at a glance, where do people perceive we have these risks that no one is thinking about? And when I've done, in the times that I do these in person with human service organizations and take them through, sometimes 100 questions related to this, I always find there's good answers probably in the 17 areas that I often cover. We probably have good answers in 15 areas. But there's always 2, and I can never predict which 2, where the leaders just kind of look at themselves and say, we never thought about that. And so the goal of these risk maps is to help you identify, what areas might you never have thought of, and then also which areas is it not really effective. So you can see, when the third step is, we have limited time, we have limited resources as an organization to make changes. There's so much going on. Where should we put in the additional effort that we have? Where should we focus that? And so a survey tool like this can help your leadership team coalesce around, we need to think more about youth, and we need to think more about, sort of diversifying our funding stream. We need to think more about compensation and benefits for, some of our lower level management employees so they consider a career with us. And when you can agree, hey, here's where we're going to focus our energies, that's what allows you to start, treating your risk on a more enterprise level. So this next section, I've pulled in my coworker Lisa Love. So Lisa, you can come off mute whenever you're ready. Lisa is a workers' compensation claim advocate. She's been working on workers' compensation claims for a really, really long time. And she's a great partner. She and I have dealt with a very thorny claim where someone drove a vehicle into a thrift store that one of our human nonprofits ran. And, there was property damage, there were employees injured, there were bystanders injured. We made the news. But sort of, we're taking a different tact here because many of you, this isn't all about, hey, we're preventing the injury. This is a bad injury has happened. Someone is missing time. What can we do about that? Is the fact that, hey, this car accident happened, are all our costs, they are what they are? Is there anything we can do to adjust those costs? So Lisa, that's kind of the stage that I'll set for
Okay.
you to give us some input.
Okay, thanks, James. Can you guys hear me?
Yeah, we can.
Okay, so that's the first test. Thank you. Nice to meet everybody, and thanks for the time. So yeah, so we really try hard to provide enough training and enough resources where hopefully we can help with safety. But it's going to be an occasion where you'll have somebody that's injured, sometimes pretty severely. And even if it's not, it's important to have somebody on your broker side come to and talk to about the claim. Hey, I have this injury that happened. What should I do? Or we're going to be filing this claim. And it's really the best time to get us involved. We're going to be filing this claim. Person, fractured or whatever the injury is, what should we do if it's severe enough? Now, the one that James mentioned was a pretty severe claim, and in that case, immediately after you get the claim reported, we immediately need to circle the wagons. We need to let the carrier know, hey, heads up, there's a big one coming your way. We need to get somebody assigned right away. We need to know who's going to be assigned and get those wheels in motion. At the crux of this, the most important thing is that your employee is taken care of quickly and in the most appropriate hands. Sometimes that could be they go to an emergency room, but we're going to know that they're probably going to need a bunch of resources assigned to them. Number one, after they're discharged, who's going to be the specialist that's going to see this individual? Is it going to be, most of the times it's an orthopedic or an orthopedic surgeon, neurology. We need to have all those, we need to forecast everything this person is going to have. So to do that, we need to hop on a call once you get the claim reported, once the adjuster has been assigned, let them do their thing and investigate the claims, and then know, okay, this is what we know. This is the person's in the hospital. This is in the information that we have. And where do we go from here? It's important that at least 30 days that you stay in close connection with one another to make sure that everything is taken care of for your employee. One slip up, one thing that didn't get done could mean the difference between you're doing a great job and the person's going to get an attorney. Usually people are directed by attorneys, most of the times by family members or other people encouraging them, for whatever reason, good or bad, to get an attorney. Our goal is to make sure that your employee is taken care of and that we're doing everything right, because it's the right thing to do anyway, and most importantly, but to make sure that they're taken care of. And there's a lot of loose ends with that, so that could be overwhelming if you're not familiar with what to do when something like that happens. So it's important to have a resource. I have years of experience, as James mentioned, many years of experience, as James mentioned, and can help with that. And anybody that you work with your broker should be able to walk you through and get that done for you, and make sure that at the end of the day that you know that there's a plan in place. And if we don't cover this at the beginning of a large claim or a fairly serious claim, it's hard, you can't go backwards. So it's hard to make up, I guess, any ground from there. So the tighter, I guess, control that we have in the beginning, and everybody knows that the I's are dotted, your T's are crossed, the smoother sailing ahead. And sometimes you have claims that, so I'll stop there. I don't know, James, if you have any questions or if there are any questions before I move on.
Yeah, no, I think that's a good kind of first step, Lisa, because I think as I was thinking about this, it's easy to think, hey, that car accident happened, our costs are what they are, but that's really not the case. And how you manage the claim, both, with your insurance company and with your employee personally, does make a difference with how much this is going to cost you.
100%.
And I think the thing and that maybe you can comment on as well is, the incident that I mentioned. This is in the newspaper, and I think
Yes.
anyone who's worked in nonprofits enough has seen instances where we're in the newspaper. We had one a couple of years ago where there was a machete attack in a day shelter at an organization that served the homeless. And, we had to have reconstructive surgery on a hand, and we had to close that shelter for a couple of weeks. And employees received, therapy for the traumatic incident that they'd witnessed.
Yes.
So sort of like there's a lot going on here that can really increase your costs and, really affect your organization.
Yeah, 100%. And you're absolutely right. Because, while we talk about preventing accidents, and that's fantastic, where we can, but once one happens, it's important to have a plan in place where everybody in your organization knows what to do when an incident occurs. Everybody knows who to call, or at least even if it's internal, and if it's any of you folks on the call here today, that they come to you, that you know what to do, that you have a resource that you can turn to, because you're going to be overwhelmed, like it was for our one client that was in the news. It was overwhelming. So you'll need somebody to help, keep things in line up adjusters, because in this case, it wasn't just a workers' comp claim. It was a property claim. It was an auto claim. It was a GL claim. So there's several resources that we have, and each one of us specializes in something. Most of us have been doing it at least minimum 15 years. So you're going to get a good line of defense to help you keep everything in line. And again, it gets very overwhelming. Now, we need to think about these things, because the first misstep that we have, again, it does not bode well for us, because this means it'll you see, they didn't do this. So off to the attorney they go. And attorneys in this case, especially if it's severe enough, they're going to make it. The attorneys always make things worse. I'm sorry if there's any on the line, but they usually don't make things better on claims. So we need to, and again, a lot of even outside of your broker, we're going to know enough to know that you should have resources made available to you outside of the adjuster from the carrier side. You may have a nurse that goes out. Maybe you need a field adjuster. We're going to need to direct those field adjusters not to, or perhaps we'll want our defense attorney there, right? To make sure that any investigations are kept under confidential so that nothing's producible, because we don't know what we might find out that might hurt the case later. So again, um, while everybody here is probably hopefully not going to have something that severe, it's always good to know that you have resources that can help walk you through and hold your hand through the process. And that could be the first 30 days. On something serious, I think it should be a touch bases on at least every 30 days until we're out of the woods, or we're at a point where the case is kind of on auto, because there comes a point where people are just treating and, we're okay not to have to look at it. Maybe we could skip a month, but those are the things that really make a difference on your high dollar value claims.
Yeah, and there's so many threads that are going on that I think as a senior leader, your responsibility is that check-in every 30 days and go down the list. Have we are all of the adjusters current with us? What else needs to be done? What are we waiting on? Because I'll tell you, being in and out of nonprofits for almost 15 years, these big incidents, they do happen. And when they happen, not only do you have to deal with the injured employee, you have the rest of the employees. You're going to have pressure, I think, almost always from your board. Oh my goodness, I can't believe this happened. What are we going to do differently? It's interesting, a lot of times boards will actually open up the checkbook and say, we need to spend on this, and we need to spend on this, and we need to spend on this so that this doesn't happen again. And sometimes that's wonderful, and sometimes it's a little bit overboard. And so you need to be able to, work with your advisors to really get a benchmark. How unusual was this? Is this just is this, bad luck, or were there some systemic issues that we need to change? I think everyone in the human service world is serving difficult to serve populations. If they were easier to serve, their families would probably take care of them. But we're taking on these difficult to serve populations. And so there are going to be some adverse outcomes. Sometimes they're our fault. Sometimes they're not our fault. And so we need to be able to, provide good context to our board members to, to say, yeah, this happened and here's where we could make some improvements, but, we don't need to swing to the side of, oh my goodness, I guess maybe we'll shut down this program, or, and it's important to note, to my last points, you have a big workers' comp claim payout. A lot of these times, these incidents that hit the news, when all is said and done, it's $1 million that's been paid out. And those of you that buy insurance know, if your insurance company is paying out $1 million, what are they going to want from you on your next renewal? Hopefully not an additional $1 million, but it's going to be more. The insurance companies are going to want to start to recoup their losses. So really significant dollars. And, I've appreciated Lisa's help and expertise in the claim I referenced and just here today. So thank you, Lisa.
Yeah, no problem.
Let's see. In I believe our last polling question, after today's presentation, what is one action or change you plan to implement within your organization? Review or update our risk mitigation policies, A. B, begin tracking new KPIs. C, explore or enhance the use of interactive dashboards. Or D, other. I would also say Gallagher is investing a lot in creating interactive dashboards for our clients. And my guess is a lot of your other more sophisticated vendors are as well. We use them a lot for multi-site organizations so they can look at claim trends and try to understand, where are the claim trends? Again, where can we get the most return from additional risk mitigation dollars? And my guess is a lot of your other vendors do that as well. So I would say continue to be open to those. And again, it's not a silver bullet, but it is a tool that helps you hone in on the areas that need your attention. And now we have a little bit of time for Q&A. I think the Q&A is best going to be dropped in the chat. So we welcome any and all questions in the 5 or so minutes we have left. So Kevin, while people are thinking of their questions, I don't know if you were sort of our maestro
Yeah.
coordinating everything. I don't know if you have questions or comments having listened to it all through.
No, I think that was really great, James, and I appreciate Lisa and Chad joining you today. I will wrap it up today by saying thank you for attending. If there are questions about the materials that you get, by all means, you're looking at all of our contact information, so feel free to reach out. And if we could be in any assistance throughout the year, obviously, please keep us in mind. So thank you very much. I don't see anything in the chat. We'll be in touch with the slides. We'll be in touch with CPE information for those of you who need it. And we look forward to our next sessions. So please keep in touch. Thank you.
Thank you, everybody.
Thanks, Kevin. Appreciate you guys organizing and leading this.
Thanks, everyone.